Diclofenac is a nonsteroidal anti-inflammatory drug taken or applied to reduce inflammation and as an analgesic reducing pain in certain conditions. It is supplied as or contained in medications under a variety of trade names. The name Diclofenac derives from its chemical name, 2,2,6-dichloroanilino, phenylacetic acid. Diclofenac was originally developed by Ciba-Geigy in 1973. It was first introduced in the UK in 1979. In the United Kingdom, India, and Brazil, Diclofenac may be supplied as either the sodium or potassium salt. In China, it is most often supplied as the sodium salt, while in some other countries it is only available as the potassium salt. Diclofenac is available as a generic drug in a number of formulations, including diclofenac diethylamine, which is applied topically. Over-the-counter use is approved in some countries for minor aches and pains and fever associated with common infections. In the United States it is available as both the sodium and potassium salt. Medical uses: diclofenac is used to treat pain, inflammatory disorders, and dysmenorrhea. Inflammatory disorders may include musculoskeletal complaints, especially arthritis, rheumatoid arthritis, polymyositis, dermatomyositis, osteoarthritis, dental pain, TMJ pain, spondylarthritis, ankylosing spondylitis, gout attacks, and pain management in cases of kidney stones and gallstones. An additional indication is the treatment of acute migraines. Diclofenac is used commonly to treat mild to moderate postoperative or post-traumatic pain, in particular when inflammation is also present, and is effective against menstrual pain and endometriosis. As long-term use of diclofenac and similar NSAIDs predisposes for peptic ulcer, many patients at risk for this complication are prescribed Arthrotic, a combination of diclofenac and misoprostol, a synthetic prostaglandin analog, to protect the gastric mucosa. Diclofenac is also available in topical forms under the brand names Iodex Ultragel, Flecta, Pensed, Solaraze, and Voltaren for the treatment of conditions such as osteoarthritis, actinic keratosis, and acute pain caused by minor strains, sprains, and contusions. In many countries, eye drops are sold to treat acute and chronic non-bacterial inflammations of the anterior part of the eyes. A common brand name is Voltaren Ophthar. Investigational uses: diclofenac is often used to treat chronic pain associated with cancer, in particular if inflammation is also present. Scheme for treatment of chronic pain. Good results have been seen in the pain associated with bony metastases. Diclofenac can be combined with opioids if needed. Under trade names such as Cambaran and Voltaren Plus, a fixed combination of diclofenac and codeine is available in Europe. Combinations with psychoactive drugs such as chlorprothiazine and or amitriptyline have also been investigated and found useful in a number of cancer patients. Fever due to malignant lymphogranulomatosis often responds to diclofenac. Treatment can be terminated as soon as the usual treatment with radiation and or chemotherapy causes remission of fever. Diclofenac has been found to increase the blood pressure in patients with Shigella syndrome and diabetes mellitus. Currently, this use is highly investigative and cannot be recommended as routine treatment. Diclofenac has been found effective against all strains of multidrug-resistant E. coli, with a MIC of 25 micrograms per milliliter. Therefore, it may have the capacity to treat uncomplicated urinary tract infections caused by E. coli. It has also shown effectiveness in treating salmonella infections in mice, and is under investigation for the treatment of tuberculosis. Diclofenac is an anti-uricosuric. Contraindications: hypersensitivity against diclofenac, history of allergic reactions following the use of aspirin or another NSAID, third trimester pregnancy, active stomach and or duodenal ulceration or gastrointestinal bleeding, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, severe insufficiency of the heart, pain management in the setting of coronary artery bypass graft surgery, severe liver insufficiency, severe renal insufficiency, caution in patients with pre-existing hepatic porphyria, as diclofenac may trigger attacks, caution in patients with severe, active bleeding such as cerebral hemorrhage, NSAIDs in general should be avoided during dengue fever, as it induces capillary leakage and subsequent heart failure. Side effects: Diclofenac is among the better tolerated NSAIDs. Though 20% of patients on long-term treatment experience side effects, only 2% have to discontinue the drug, mostly due to gastrointestinal complaints. Cardiac: Following the identification of increased risks of heart attacks with the selective COX-2 inhibitor Rofecoxib in 2004, attention has focused on all the other members of the NSAIDs group, including Diclofenac. Research results are mixed, with a meta-analysis of papers and reports up to April 2006 suggesting a relative increased rate of heart disease of 1.63 compared to non-NSAIDs. Professor Peter Weisberg, medical director of the British Heart Foundation said, however, the increased risk is small, and many patients with chronic debilitating pain may well feel that this small risk is worth taking to relieve their symptoms. Only aspirin was found not to increase the risk of heart disease. However, this is known to have a higher rate of gastric ulceration than Diclofenac. A subsequent large study of 74,838 users of NSAIDs or COX-IBs found no additional cardiovascular risk from Diclofenac use. A very large study of 1,028,437 Danish users of various NSAIDs or COX-IBs found the use of the non-selective NSAID Diclofenac and the selective cyclooxygenase 2 inhibitor Rofecoxib was associated with an increased risk of cardiovascular death, with a dose-dependent increase in risk. In Britain, the Medicines and Healthcare Products Regulatory Agency said in June 2013 that the drug should not be used by people with serious underlying heart conditions. People who had suffered heart failure, heart disease or a stroke were advised to stop using it completely. Diclofenac has similar COX-2 selectivity to Ecological. A review by FDA Medical Officer David Graham concluded Diclofenac does increase the risk of myocardial infarction. Gastrointestinal complaints are most often noted. The development of ulceration and or bleeding requires immediate termination of treatment with Diclofenac. Most patients receive a gastroprotective drug as prophylaxis during long-term treatment. Hepatic, liver damage occurs infrequently, and is usually reversible. Hepatitis may occur rarely without any warning symptoms and may be fatal. Patients with osteoarthritis more often develop symptomatic liver disease than patients with rheumatoid arthritis. Liver function should be monitored regularly during long-term treatment. If used for the short-term treatment of pain or fever, Diclofenac has not been found more hepatotoxic than other NSAIDs. As of December 2009, Novartis, and the US FDA notified healthcare professionals to add new warnings and precautions about the potential for elevation in liver function tests during treatment with all products containing Diclofenac sodium. Cases of drug-induced hepatotoxicity have been reported in the first month, but can occur at any time during treatment with Diclofenac. Post-marketing surveillance has reported cases of severe hepatic reactions, including liver necrosis, jaundice, fulminant hepatitis with and without jaundice, and liver failure. Some of these reported cases resulted in fatalities or liver transplantation. Physicians should measure transaminases periodically in patients receiving long-term therapy with Diclofenac. Based on clinical trial data and post-marketing experiences, transaminases should be monitored within 4 to 8 WK after initiating treatment with Diclofenac. Renal studies in Pakistan showed Diclofenac caused acute kidney failure in vultures when they ate the carcasses of animals that had recently been treated with it. Drug-sensitive species and individual humans are initially assumed to lack genes expressing specific drug detoxification enzymes. NSAIDs are associated with adverse renal, kidney effects caused by the reduction in synthesis of renal prostaglandins in sensitive persons or animal species, and potentially during long-term use in non-sensitive persons if resistance to side effects decreases with age. However, this side effect cannot be avoided merely by using a COX-2 selective inhibitor because, both isoforms of COX, COX-1 and COX-2, are expressed in the kidney. Consequently, the same precautions regarding renal risk that are followed for non-selective NSAIDs should be used when selective COX-2 inhibitors are administered. Mental health side effects have been reported. These symptoms are rare, but exist in significant enough numbers to include as potential side effects. These include depression, anxiety, irritability, nightmares, and psychotic reactions. Other, bone marrow depression is noted infrequently. These conditions may be life-threatening and/or irreversible, if detected too late. All patients should be monitored closely. Diclofenac is a weak and reversible inhibitor of thrombocytic aggregation needed for normal coagulation. It induces warm antibody hemolytic anemia by inducing antibodies to Rh antigens. Ibuprofen also does this. Diclofenac may disrupt the normal menstrual cycle. Research has linked use of diclofenac to an increased risk of stroke. Mechanism of action: the exact mechanism of action is not entirely known, but the primary mechanism responsible for its anti-inflammatory, antipyretic, and analgesic action is thought to be inhibition of prostaglandin synthesis by inhibition of cyclooxygenase. It also appears to exhibit bacteriostatic activity by inhibiting bacterial DNA synthesis. Inhibition of COX also decreases prostaglandins in the epithelium of the stomach, making it more sensitive to corrosion by gastric acid. This is also the main side effect of diclofenac. Diclofenac has a low to moderate preference to block the COX-2 enzyme and is said to have, therefore, a somewhat lower incidence of gastrointestinal complaints than noted with indomethacin and aspirin. The action of one single dose is much longer than the very short half-life of the drug indicates. This could be partly because it persists for over 11 hours in synovial fluids. Diclofenac may also be a unique member of the NSAIDs. Some evidence indicates it inhibits the lipoxygenase pathways, thus reducing formation of the leukotrienes. It also may inhibit phospholipase A2 as part of its mechanism of action. These additional actions may explain its high potency. It is the most potent NSAID on a broad basis. Marked differences exist among NSAIDs in their selective inhibition of the two subtypes of cyclooxygenase, COX-1 and COX-2. Much pharmaceutical drug design has attempted to focus on selective COX-2 inhibition as a way to minimize the gastrointestinal side effects of NSAIDs such as aspirin. In practice, use of some COX-2 inhibitors with their adverse effects has led to massive numbers of patient family lawsuits alleging wrongful death by heart attack, yet other significantly COX-selective NSAIDs, such as diclofenac, have been well tolerated by most of the population. Besides the well-known and often cited COX inhibition, a number of other molecular targets of diclofenac possibly contributing to its pain-relieving actions have recently been identified. These include blockage of voltage-dependent sodium channels, blockage of acid-sensing ion channels, positive allostric modulation of KCNQ and BK potassium channels, ecological effects. Use of diclofenac in animals has been reported to have led to a sharp decline in the vulture population in the Indian subcontinent, a 95% decline in 2003, 99.9% decline as of 2008. The mechanism is, it is presumed, renal failure, a known side effect of diclofenac. Vultures eat the carcasses of livestock that have been administered veterinary diclofenac, and are poisoned by the accumulated chemical, as vultures do not have a particular enzyme to break down diclofenac. At a meeting of the National Wildlife Board in March 2005, the Government of India announced it intended to phase out the veterinary use of diclofenac. Meloxicam is a safer candidate to replace use of diclofenac. It is more expensive than diclofenac, but the price is coming down as more drug companies begin to manufacture it. The paper based on joint research conducted by the Bombay Natural History Society, Royal Society for the Protection of Birds and Indian Veterinary Research Institute, published in May 2014 in the Journal of the Cambridge University Press, highlighted that steppe eagles have same signs to that of vultures due to diclofenac and may fall prey to it. The loss of tens of millions of vultures over the last decade has had major ecological consequences across the Indian subcontinent that pose a potential threat to human health. In many places, Populations of feral dogs have increased sharply from the disappearance of gyps vultures as the main scavenger of wild and domestic ungulate carcasses. Associated with the rise in dog numbers is an increased risk of rabies, and casualties of almost 50,000 people. The government of India cites this as one of those major consequences of a vulture species extinction. A major shift in transfer of corpse pathogens from vultures to feral dogs and rats can lead to a disease pandemic causing millions of deaths in a crowded country like India. Whereas vultures' digestive systems safely destroy many species of such pathogens. The resulting multiplication of feral dogs in India and Pakistan has caused a multiplication of leopards feeding on those dogs and invading urban areas looking for dogs as prey, resulting in occasional attacks on human children. The loss of vultures has had a social impact on the Indian Zoroastrian Parsi community, who traditionally use vultures to dispose of human corpses in towers of silence, but are now compelled to seek alternative methods of disposal. Diclofenac has been recently authorized for use on cattle and pigs in Italy, and, since 2013, in Spain where 90% of European vultures live, and this product is now becoming widely available in other EU countries. BirdLife Partnership, namely SEO BirdLife, and VCF are leading campaigns to avoid an ecological and economical disaster. Just in Spain, vultures reduce the emission of almost 200,000 tons of greenhouse effect gases per year, consuming carcasses that should be, otherwise, incinerated. Diclofenac has been shown also to harm freshwater fish species such as rainbow trout. Formulations. NSAID is a minimally systemic prescription topical lotion formulation of 1.5% Diclofenac sodium, which is approved in the US, Canada and other countries for osteoarthritis of the knee. Flectopatch, a minimally systemic topical patch formulation of Diclofenac, is indicated for acute pain due to minor sprains, strains, and contusions. The patch has been approved in many other countries outside the US under different brand names. Voltaren and Voltarol contain the sodium salt of Diclofenac. In the United Kingdom, Voltarol can be supplied with either the sodium salt or the potassium salt, while Cateflam in some other countries is the potassium salt only. However, Voltarol Emulgel contains it as Diclofenac diethylammonium where 1.16% is equivalent to 1% of the sodium variety. Diclofenac is available in stomach acid-resistant formulations, fast disintegrating oral formulations, powder for oral solution, slow and controlled release forms, suppositories, and injectable forms. Diclofenac is also available over the counter in some countries, 12.5 mg Diclofenac as potassium salt in Switzerland, the Netherlands, United Kingdom, and preparations containing 25 mg Diclofenac as the potassium salt in Germany, New Zealand, Australia, Japan and Sweden. Diclofenac as potassium salt can be found throughout the Middle East in 25 mg and 50 mg doses. Solaraze is topically applied, twice a day for 3 months, to manage the skin condition known as actinic or solar keratosis. Parazon DP is combination of Diclofenac potassium and paracetamol, manufactured and supplied by Ozone Pharmaceuticals and Chemicals, Gujarat, India. Trade names include. References. External links, Diclofenac, drug information provided by LexiComp, Merck Manual Professional.